Yeah, welcome everybody. Thank you for joining us today and taking some time out to hear about the research we've been doing. Oh, where's my forward button? There's my forward button. So today we're going to talk you through the results that we've gathered sort of around women's experiences of economic inactivity due to either caring or studying, or for a lot of them both. Well, first of all, we'll give you an overview of the research, our approach, talk you through findings about women's experiences, what we heard from them, go on to look at some of the enabling factors that they've identified, and then finally looking at what the implications are of the research in terms of, sort of recommendations for policy and practice and what might change. So first of all, I'll hand over to my colleague Sophie, and she's going to tell you a bit more about the research.
Thanks, Laura. Yeah, so a bit about the research. First of all, I'll just explain who we are. So we are from KADA Research. We are a social and economic research consultancy with offices in Sheffield, Gateshead and the South West. On the call today is myself, Sophie, Laura and our colleague Emily, and we all took part in the research over the last 6 months or so. In terms of what KADA does, we work across a range of different projects, from this sort of exploratory work that we'll be talking about today right through to evaluation. And in terms of research in this area, we have extensive experience of research around unemployment, economic inactivity, health and the support that residents require around that. For example, we carried out the in-depth qualitative research with Barnsley residents, which informed the Pathways to Work Commission, which then went on to inform the Get Britain Working White Paper, which is ultimately why we are here today. So really great to be talking about this work and seeing what happens next. So in terms of this piece of research, like any good piece of research, it started with a puzzle or a question, and this really started from a question around data. So in terms of economic inactivity, from the data we can understand numbers, so the levels of economic inactivity in a certain place. We can also understand trends over time, and we can also understand to a certain extent the reasons behind this, as long as you fall within a certain set of categories. But what we don't understand is what's driving the economic inactivity. We also don't understand what happens if you fall outside of those categories or you fall within multiple categories. And we also don't understand the experiences, impacts and responses of economic inactivity. So this is why this piece of research was commissioned, to understand women's lived experiences of economic inactivity in York and North Yorkshire, because the data didn't allow us to fully understand the experience or the problem or the solutions that may be required to help these women. So in terms of what we've been doing, we've carried out some qualitative research, which I'll talk about in more detail in the next slide, focused on women who were not in work, either due to caring or study, or quite often both. And this research builds on the existing evidence that is available by adding that lived experience. So what is holding women back? What are their experiences? What are their aspirations? What are their strengths? And what could help them to realise that, and for others around them to realise that as well. So in terms of our approach, as I touched upon in the last slide, on the left is the objective. So first of all, it's to develop that understanding of the lived experiences, of the motivations, barriers and enablers for women within this group. It was then to generate from that understanding insights that could inform the future kind of delivery, service design and how to engage with these women. And then collating all that evidence, it was around providing useful and actionable outputs like this forum today to inform policy, funding and provision. And in terms of the process that we took, so we've been working on this for the last 6 months or so. It began with sort of a scoping and planning phase, which I'll talk about in more detail on the next slide. but the key part of that was around engagement, both with partners, so organisations who were working with these women, and the women themselves. And then we move into phase 1, which was around generating that in-depth insight through 20 interviews with women from across York and North Yorkshire, and also carrying out a focus group. So that was all to build our understanding of what the experiences are, what the barriers are, and what those opportunities are to support them. And then moving into phase 2, we carried out a second focus group, and that was really to sense check the findings from the first phase, so to make sure what we'd heard was reflective of those experiences, and then also to continue to develop ideas and kind of co-design solutions of how we could better support these women. So in terms of engagement, by their nature, these women can be hard to find in a sense, because they might not be engaging in certain services, or might have sort of different routines. So we focus quite a lot on how to engage these women, and we started this process by engaging kind of organisations who would be connected to those women. So we held information events in January where we promoted the research, explained what we wanted to do, and asked organisations if they could help us connect to the women. We also had flyers, so physically handed out in different locations, and also on social media as well. So it's quite a broad engagement activity. And then what we asked women to do, if they were interested, was to get in touch with us in various ways, so by email, text, or by phone. We then screened them for eligibility, and then as long as they passed that, we invited them to an interview in the most convenient way for them. So whether that was in person, by phone, or online. So in terms of who we spoke to, in total, we spoke to 41 women in the research process, and that was spread across the 2 phases. So 20 women in the first phase and 21 women in the focus groups. And that was spread across the local authority districts, and also the type of area they might live in, so whether that be coastal, urban, or rural. So obviously within York and North Yorkshire, there's a real mixture of geographies. And in terms of the sort of the experiences of the women that we spoke to, most of them, so 19 out of 20, had caring responsibilities, and that could be for children, that could be for adults, or a mixture of both. Over half, so 12, combined caring with study. And the average age of the women was between sort of 30 to 50. And in terms of geography, the map here just shows how it was split across the area. So we've got over half in either kind of coastal or more rural areas as well. And I think that's an important point around York and North Yorkshire, is the geography, and that did really make a big difference as to the support and the challenges that the women faced, which Laura will pick up on in the next section.
Great, thank you, Sophie. Yeah, so with the next few slides, I'm going to really focus on what we've heard from those 41 women, and what their experiences were and what their insights were. Although there were a lot of different individual experiences, every single person had a slightly different story, different circumstances, etc. We heard really quite a lot of broadly consistent messaging. Over the next few slides, I'm going to go through these in more detail, but it's a bit of an introduction and overview. There were probably 5 key areas of that experience. So very much, most of the women we talked to had some caring responsibilities, and caring very much comes first. It's constant, it's round the clock. It really influences all the other decisions that they make as well. Often it's quite invisible as a role. Women didn't necessarily identify with that label as sort of carer, which can kind of influence how they see themselves, but also how that means they then go on to interact with services, with employers, whether they're visible to kind of the support organisations that might be able to help them. For a lot of them, they talked about study being sort of a lifeline, a route forward, but we also heard that that had to be sort of flexible, adaptable around their other commitments. The barriers where they face barriers really do sort of stack up and compound each other. We heard about transport, about time, financial constraints, and sort of the identity and confidence aspects as well. Those intersected quite a lot. And predominantly, we heard that women did want to work. The women that we talked to often had plans either to work in the immediate future, or they would like to now but are constrained, or they'd like to sort of in the medium term. So, for example, parents of young children often were planning to go back to work when children reach school age. And they needed that flexibility, the right support, and they were keen to move forward around employment. So yeah, they really are very broadly constrained by their circumstances rather than sort of any motivation or any of that kind of aspect. So yeah, to kind of touch on these and go into these in a little bit more detail over the next few slides. 19 of the 20 interviewees, as we said, they had caring responsibilities. So that was for children, including children with additional needs. It was for their own parents or in-laws. It was for their partners or siblings of kind of the same generation. And often it was for several people at once. So, sandwich carers, for example. And for some of them, it meant that they were also living with them, either kind of in that, either the children who are living with them or the parents living with them, etc. But even when they weren't, they talked about it being sort of round the clock, always being on call or on duty, even if that's not in a residential situation. We heard that caring can often be very unpredictable, that their day or week is really built around the needs and priorities of the person they're looking after or people they're looking after. And that even when they have got kind of free time in terms of their schedule, it isn't really sort of fully free in terms of kind of that thinking and planning and prioritizing. And that really, really built into the fact that actually the load that they're carrying is really mental and emotional. It's not just practical. So there were elements of personal care or medication or appointments, advocacy, transport, supporting kind of emotional support for the people they're looking after. But actually, it's not just kind of scheduling those in, ticking those off a list. It's that mental and emotional load on the women themselves of doing that and keeping track of all of that. As I mentioned in the overview, a lot of them don't identify with their label of carer, especially if they're not sort of formally in receipt of carers allowance or something like that. So they miss some of the support that's designed for them, or the support organisations can't see them. And that can then also make it's hard for employers or services or even the benefits system to sort of see that they're there and in need of that support. And we heard as well, it's sort of particularly acute for parents of carers, parents of children with additional needs. Typically parents, the people we spoke to who were mums, were saying, when the children go to school, there's kind of a bit more flexibility in the schedule. For parents with children with additional needs, actually, school can increase demands around caring because they've got to think about advocacy and working with the school and getting the right support in place in that situation. And for carers who were looking after loved ones with progressive or life-limiting conditions, there was obviously, a lot of complex emotion around processing that and that interaction as well. So we heard from sort of most of the women that actually it becomes a really main focus of their identity. Women express that, they, instead of having this personal kind of sense of self, it's about the person they care for. And that could be very frustrating where they had a lack of agency around that. So if they felt that they'd been driven into caring through having no other choice, definitely landed differently than those who'd kind of more willingly made that choice to kind of prioritize caring at this stage of their life. And I think this is a really beautiful quote to sort of sum up that sort of the invisible mental load, the effort and the mental and emotional weight they're carrying. So one of the participants told us, honestly, it feels like I'm running a marathon every day, but I'm doing it in high heels and I'm carrying somebody else's backpack. We heard, obviously, we were really interested in sort of the intersections between caring and studying and if there was a relationship there. And if that was causal, if, people did caring, then studying and then work, or if it was some other relationship. And I think there isn't a clear linear pattern in the relationship between caring and studying and their economic and activity, but there is definitely very much an intersection and an overlap in how those develop. So we heard two kind of key things around the women who were studying. So it was, I think 12 of the 13 of the women were studying, 12 of who were also caring. We heard that studying is a route back into work around practical qualifications or reskilling or retraining to do a career change after having been out the workforce while caring. And that can be really, really valuable. It can help build confidence. And actually, some of the women were really engaged in study for just that, the confidence for having something to do that was for themselves, for their own sense of identity. We heard that it works really, really well when it is flexible, for example, online or hybrid courses, having sort of support and understanding from tutors and institutions. But we also heard some examples around sort of more rigid rules around attendance in person, things like that, that could make it really hard to balance with caring responsibilities for those women who are doing both. And that financial concerns were really a big overlap as well, where sort of training courses are subsidised. That was really, really valuable for some of the women. But also we heard that it could, cost either time that they could have been working to train, that's a lost income stream, there's course costs, the travel costs, and oftentimes these are women who are already in sort of financial, more strained circumstances because of their economic inactivity. So yeah, there's not kind of always as well, even when they're sort of doing qualification, there isn't always necessarily a clear pathway sort of after we've done that training course, what does that look like in terms of then moving on into suitable, sustainable work long term as well? We really heard that the barriers that women are facing, they're compounding. They're not just kind of adding up, but they're actually interacting and intersecting with each other. So the key ones here, time poverty around sort of round the clock caring, or the mental and emotional load of that, meaning there's not sort of the time and mental space for job seeking or for work, and how that kind of works across the week, and sort of looking for work, advocating for yourself in terms of what you want to do, as well as the actual physical time to go to a workplace. Transport and distance were a really big thing, and obviously this was most acute for women who lived in rural or some of the coastal areas, where we heard that actually having a car was essential, not just convenient, either through a lack of public transport or where public transport journey times were so long that they didn't feel that was practical. They might need to be able to get home within sort of 10, 15 minutes rather than half an hour to an hour to fit around other responsibilities. And that also influenced which jobs they felt they were able to apply for or be eligible for as well. We heard examples of employer inflexibility, so perhaps sort of an on paper statement that flexible working is considered, but actually not necessarily then being the right type of flexibility to fit around that person's sort of schedule. We heard some examples of women who are saying that there is sort of a cultural default to in-person attendance, even where that's not essential for the role. And obviously there are some jobs that don't work with flexible working, but there are lots that could. And that asking for those adjustments and flexibility can be really hard, especially, you're applying for a job, an employer doesn't know you, or you then kind of asking for too much, is that going to compromise your ability to be offered the job? That sort of concern or worry side of it as well. The cost of replacement care was a big one. So childcare while you're at work, or replacement care for adults while you're at work, it can cost more than you end up actually earning. And also there were either real eligibility concerns or perceived eligibility concerns around benefits eligibility if you start working as well. And a big one as well was lost confidence. So the longer somebody is out of work and is economically inactive, they might lose some of that professional identity and confidence if they've worked in the past. But there's also an element of, people have got transferable skills through caring, so logistics, planning, communication, advocacy. There's no formal recognition system for that as well. So it can be hard for women re-entering the workplace to be able to communicate those soft skills and why they're important. And obviously, all of these things have an impact on women. We heard that this was really around the mental and physical health. So we heard about exhaustion, about anxiety and depression in some cases. and that these are really compounded when it overlaps as well with sort of constrained financial circumstances or financial hardship. And one thing we heard time and time again is women saying, well, I've been struggling with this, but I don't have time or ability in my week to see my GP for myself. I'm more concerned about the people I'm caring for, and they're not prioritizing themselves often in that circumstance. Again, as I mentioned before, the identity and sense of self is really important. It being sort of defined as, are you, or are you only a carer or only a parent? And that can also change sort of over time. The longer sort of someone is caring, the more that perhaps have that. And so some of them it's positive, some people really, really happy in their caring role. But we heard, especially when it was something they'd got into sort of out of circumstance, they didn't feel they'd had that free choice in taking on that caring role, but actually there was no one else to do it and they had to. That could really sort of influence people's feeling around that and their sense of identity. And we heard as well that it kind of becomes a bit of a cycle. So they take time out of work in order to caring more full time, but then that means obviously lower income because of not working. That means less ability to sort of get the support that's needed if it's not kind of cheap or free. Less time and capacity for doing sort of training or for looking for work or for doing things for yourself as well. And that kind of becomes a bit of a loop. And I've pulled out another nice quote from that one. Say nice, another illustrative quote from the research here as well. So the barrier isn't the caring, that isn't the parenting. For this woman, she actually said it's much harder. It was sort of to step away from kind of the constant thinking and doing of the parenting to do something for herself. And I think, yeah, the real things for a lot of these women, they want to work. The women that we spoke to, they sort of engaged with the research because they felt it was relevant sort of for them to share those experiences of wanting to work and being constrained by those circumstances. So the ways that women respond to this situation is they talk about actually studying is a real lifeline, either to a specific route into future work, or as we said, around that kind of having something for themselves. We heard lots of examples of women who are volunteering to sort of get that structure and sense of purpose and sometimes work experience. Often also they're using sort of the experience they've gained through their caring and taking that out to sort of give back to the community from what they've learned there. And it can be a stepping stone to work, but the paid work has to sort of be the right kind of paid work that will align with that as well, of course. We heard about people building peer networks, word of mouth, groups around a particular sort of condition or illness, or groups around parenting, faith communities as well, really important, sort of sharing information, but also for kind of that moral support, knowing other people are in a similar situation to yourself. We heard some really nice examples of people who are talking about the way that they wanted to get into self-employment. They were either starting to do that or they had plans to do that. And that was largely because they wanted sort of that control over their own working day or week, over their hours, the conditions, how they fitted that in. And we heard lots of optimism and lots of positive stories as well. So women talking about what they can do, trying to address the barriers, but obviously also hand in hand with frustration if that wasn't something they could manage themselves. Obviously, we spoke to all these women, very much not a homogenous group. We had lots of different individual stories. We've pulled out kind of a couple of the nuances here around some of the different kind of circumstances that influenced those experiences. As we mentioned in sort of talking about transport, rural and coastal women particularly noticed those acute transport issues and a lot of the other barriers around sort of availability of support, etc., really, really compounded by that geography. As I mentioned earlier as well, parents of children with additional needs, they had some particular challenges sort of around the advocacy and finding that longer term care and support, but also when their children were progressing sort of into adulthood, that transition from child to adult care services, we heard wasn't always that well joined up, or was hard to navigate. And there's a real reluctance there to engage in sort of, even if childcare perhaps does exist, is it the right suitable kind for the needs of their children if they've got those additional needs? A few of the women that we spoke to had experience of being refugees and had gained settled status and talked about how there was support for them initially, but as soon as they enter work, that drops off a cliff edge and there's no sort of gentle transition. And also it's time limited from when they've kind of got that status. Often also, if they've got qualifications from a home country, it can be hard to get those recognised in the UK system. And language barriers, perhaps an issue as well. So English for speakers of other language courses were really important for them. And we heard that for sandwich carers, so this is, you know, people who are caring for their own children, but perhaps elderly parents or other relatives at the same time, that could feel particularly long, particularly never-ending, and they noticed a particularly compounding effect of the barriers through that circumstance. And cross-cutting all of it again is this part where, you know, somebody, if they want to work, they need to be able to get replacement care, whether that's childcare, after school wraparound care, replacement care for an adult, such as day centre or carers coming in. There's a real financial cost to all of that. And actually, does that balance out against how much they could earn if they were going out to work? Just touch really briefly here. Obviously, there is lots of support out there, but it can be really sort of a bit of a postcode lottery. It can really depend on geography in terms of, is that available nearby? And the support does exist sometimes, or it does exist, but it's not quite right, or it does exist if you can pay sort of an entry fee to get into it. But a real barrier as well is the information around it. So awareness can be low, and this also overlaps, of course, with women not kind of necessarily seeing themselves as carers. And a lot of the time they talked about, actually, they learned the most about it through word of mouth among other people in their circumstance, and didn't feel there was kind of clear signposting, sort of that sort of idea. A lot of them were relying on those informal family and friend networks, so it was obviously more challenging where people didn't have that strong local community, especially if they lived further away from family. Statutory services we know are really stretched. They can be bureaucratic or eligibility barriers to getting that as well, and very sort of complex changes from child to adult transitions, or complexity in working out how that works. And health services, again, sometimes it was brilliant, sometimes it was less good. And that really sort of navigating that, advocating for yourself and your access for healthcare as a carer and accessing healthcare for your loved ones, just added to that mental load. And the voluntary community sector, obviously absolutely essential here. They were doing a lot of things, but we know that the funding can be really precarious there, and it can be, again, postcode lottery in terms of what's available on your doorstep or close enough that you can easily get to. And one woman actually said, it's really, really interesting way of or really good example, is that she said, it'd be really good if, you know, you go along with a loved one to a medical appointment, they find out they've got sort of a condition or they're diagnosed with something that means you're going to be stepping into a caring role. She said it'd be really good if at that moment someone just handed you over a ring binder with all of the information that you needed to know. She said that doesn't exist. People are very often well-meaning, but they're limited in what they know, what they can signpost to, and systems aren't set up to share that information. So having that clear one single place to go to find the information was really, really important. I'm going to hand over to my colleague Emily now. She's going to tell you about some of the enabling factors. I've done the doom and gloom, and she's going to tell you about some of the positive things.
Thanks, Laura. Perfect. So to begin with, I think it is, as Laura's already said, important to stress that, you know, these enablers are not necessarily for every single woman in every single circumstance, much like barriers. You know, everyone has unique barriers, and everyone will have unique enablers that will support them to enter work if that is something that they want to do. And that the enablers, even though, sorry, could you move on to the next slide, please? Thank you. Even though that we have like numbered these enablers, that's not to say that they are linear or that one is the most important. It's to say that all of these enablers can stack together to support a woman who wants to work to re-enter work or to enter work for the first time. But it's not the case of, if you were to address flexibility, that every woman currently out of work will suddenly be able to enter work, because there may still be barriers around affordable care or recognising the skills that carers have. So really this section is about the different enablers, what they mean, and how they're applied in the different settings for the women that we spoke to. So we'll be looking at the different people and systems that women quite often interact with, and how the systems can support them better than they currently are. Could you move on to the next slide, please? Thank you. So from an education provider perspective, as we've already touched on, that need to attend in person or to have a very rigid kind of class structure can be really difficult for those who have caring responsibilities, given the unpredictability and time poverty that we've already discussed. So having an online or hybrid learning option that can fit around that is really, really important. So this might be that classes are recorded so that they can be watched at a more convenient time or date. It might be that in-person attendance isn't necessary and won't go against an attendance register or a performance. It might be that deadlines and study is flexible, that resources needed to complete assignments are available online and don't need to be collected from a library. And all of this comes down to as well that the classes themselves are structured in a way that works for these women. And a lot of that will come down to tutor understanding and tutor compassion. And of course, it's important that while having a tutor that really does understand and listen came out as consistently one of the most important things for the women we spoke to, it's important that this isn't just done at a kind of discretionary tutor by tutor level, that colleges and higher education systems need to have a kind of system-wide service in place that is clear on application that this support is available for these women. They shouldn't need to feel that there isn't anything in place, or they shouldn't not know where to look, because we know that that can lead to disengagement, dropouts, or just not even engaging in the first place. So it's really important that we have supportive tutors that are trained to recognise caring responsibilities, and that is then backed up at an organisational level. As Laura's already mentioned, for those who have recently granted settled status, language can be a huge barrier. So having that continuation of English language support is important, not just for the ability to pick up the language and learn the skill, but also in terms of confidence in speaking to others, that sense of kind of community cohesion that comes along with being able to communicate with those you're around, and also kind of understanding that application process, be that for kind of job seekers benefits or for job applications themselves. Being able to navigate that often requires a level of English that's really important to support for those that have recently been granted status. We've already obviously spoken a lot about childcare, and childcare is a huge one, and I'll come back to it a little bit more on one of the later slides, but having childcare on site where possible can be really, really important. So that can mean that you don't have to source kind of consistent care every week if you're able to bring your child with you. That can really help, and it can kind of increase the confidence of a lot of the women as well who we spoke to, who feel that they're not, it was quite common that women spoke about a sense of kind of guilt or feeling that they should be with their child. So being able to bring their child with them can kind of remove or decrease that barrier. And then of course as well, transport. If we have online courses or remote learning, that can then remove the need to rely on kind of unreliable or infrequent or long public transport. So that can be a key enabler for the women, but of course it's important to kind of caveat that with, it's important that the women aren't just expected to undertake remote learning if that's not their preferred method, and it shouldn't be that they're forced to undertake remote learning because there are no transport options. So that's it's an enabler, but it's also a barrier if we kind of forget about the transport side of it as well. Could you move on to the next slide, please? Thank you. So in terms of peer and community support, as we've already discussed, it's absolutely key for a lot of the women. For the women we spoke to, kind of peer groups and faith groups and friends who have similar experiences is often one of the first places that the women go and women turn to before they turn to any other kind of more formal services. That sense of trust and having something that is kind of hyper local and on the doorstep is really, really important, and making sure that those services are understanding to the specific needs. You know, a woman caring for a young child will have a very different experience of caring to a woman caring for a parent with dementia, for instance. So making sure that those peer groups are accessible and cover the right conditions and circumstances is really important. And I think sometimes when we speak about the kind of VCSE sector, we sometimes think of it as kind of filling the gaps in formal support. And while that is sometimes the case, and these services do see an increased demand where formal support isn't able to offer the level of support due to capacity or funding constraints, a lot of the time this support must operate alongside the formal support. It's not a kind of or optional add-in. It is absolutely vital for a lot of these women in order to access some of that more formal support. Oftentimes that is accessed through these peer and community groups. And as we've said, the funding and capacity of these is often stretched, and that can mean that for some women they can't afford to go, or there's none available in the local area. So ensuring that there is funding in place to deliver this really hyper-local support for these women for whatever specific circumstance they're experiencing is really, really important. And we can sometimes see instances where, you know, you can attend these spaces and then get signposted onto more formal support. You may attend a class specifically for childcare, and then they will then identify that actually you would benefit from income maximisation support, or there's this employment programme that would be really good for you, and it can be a really important front door. And it's not just as well kind of support for caring. As we've said, it can be quite common for a carer as well to become quite small, and that they become just a carer. Whereas having classes available that are for hobbies and interests and skills development is also really important. It can act as a really important respite care for the carers themselves. The ability to spend a few hours undertaking a hobby or an interest that they actively enjoy is key for both building confidence and reducing that kind of cognitive load that they carry, and can then also obviously help develop employability skills and study skills if it's something that they wish to progress into. Could you move on to the next slide, please? Thank you. So as I said, the formal support at the moment, what we found is that where formal support works, it is a real enabler for the women to move into study or work. But in instances where it's not delivered kind of in a timely manner, particularly where you have drop-off points between childcare and adult care, it's quite common to hit crisis point, and that can really push women quite far out of the labour market as they kind of scramble to bridge that gap between those services. So ensuring that formal support is in place at the right time is absolutely vital. And one of the largest kind of barriers in terms of care is that both replacement care costs and replacement care quality can be a real obstacle. So we spoke to some of the women who had found affordable care, but they didn't feel that it met the needs of those that they were caring for. That's particularly the case for women caring for children with additional needs, or women caring for parents or older relatives with more complex conditions. The care that is needed for those groups is not to the standard that they feel that they could give themselves. And as a result, even though it is affordable, it's not taken up. And conversely, sometimes we found cases where there is the right quality of care there, but it was just not affordable for many of the women that we spoke to. So I mean, one enabler that can support women with, especially with childcare, is kind of that school provision, be that breakfast clubs or after school clubs. That can be really, really helpful in kind of kind of working around those core working hours. But obviously, you know, schools aren't open year round, so we need to think about what can we do over the kind of summer breaks and Christmas breaks. What sort of provision can we put in place during those periods that can ensure that there aren't gaps in that caring support? As I've already mentioned, there is a real need for that single front door approach, that if you attend any service, you should then be directed to all the relevant services that you might need. It can be incredibly kind of damaging to be repeating kind of possibly negative or upsetting circumstances multiple times to multiple people, and having that kind of one front door joined up approach can mean that, you know, people's stories aren't lost in the system, and that support is given at the right time and to the right people. Can you move on to the next slide, please? And I suppose just in terms of that employment point, that the role of employers is so important in this. You know, we can put lots of support in place, but if the right jobs aren't there, a person can't move into employment, and that's why the role of employers in this is absolutely vital. And I think it's important that we do appreciate that employers are facing a lot of demands at the moment, you know, with rising kind of business costs and the like. They're already being asked to do quite a lot. But these are kind of very actionable and enablers that can really support women to enter the workforce. And what we know is, as Laura's already said, a lot of the women we spoke to are very motivated and have some fantastic skills that they've developed through their caring, that would kind of be a real value to a workforce. And there's just this kind of untapped potential at the moment that these enablers can support. So, for instance, where we have jobs that are on site at 9 to 5, you know, the women were realistic. Some jobs they understood cannot be undertaken remotely, but for those that could be done hybrid, there could be more flexibility to allow that. Looking at kind of core hours and school hours and thinking about how work can fit around those came out as a real enabler. And just making sure that those conversations are had as well. You know, a lot of the times we spoke to a woman who said that, you know, sometimes employers think that being a carer means that you'll be in and out of hospital every other week and you'll be kind of away from your desk for hours at a time. Whereas in reality, for a lot of carers, it actually might not be that you're away from work for that many hours at all, but it's that knowledge and having those conversations and that training that's really important. So kind of making it as easy as possible for employers to access that training and understand that the adjustments that may kind of unlock a real potential in the workforce actually might not be all that costly or all that time consuming, and it is just having those conversations and recognizing some of those skills, like advocacy, like organisation, like administration, that these women have developed through their caring, that are really, really valuable employability skills, but on paper they're sometimes not recognised. So kind of having opportunities to showcase that and to understand how a carer develops those skills and what that would mean for a workforce is really, really important. And I think that is kind of where we are on enablers. So I'll hand back to Laura to talk about what that will then mean for the Trailblazer and for York and North Yorkshire.
Yes, thank you, Emily. Yeah, brilliant. So a lot of really, really interesting enablers there. So for the last few slides here, I'm going to talk about what actually does that mean, what are sort of the implications of policy and practice, what kind of the recommendations we're making, and how that might work in reality. So as we've heard, these women largely, they want to work either now or in the future. They're a motivated sort of talent pool. York and North Yorkshire as a region can really sort of, if we can unlock that and tap into that, there's a real huge kind of potential benefit there. They're not economically inactive kind of by free choice. Sometimes it is by choice, but it's not sort of a free choice. It's by circumstance. It's that the role they've ended up in has kind of pushed them out of the labour market. Many of them are already, they're studying, they're volunteering, they're running things informally in kind of community groups. So there's a lot of drive there. the barriers that we've heard, they are real, and a lot of the time they are really, really big, and at an individual level they might be insurmountable, but at a systemic level they are fixable. That's kind of the optimism here, is there's a lot that can be done, small things that can be done to really help. And for when we talk to sort of having these routes into work and study, a lot of it's about identity and independence as well as income. Obviously income is important, but being able to sort of use their skills and add that value back into the world is very much what a lot of them are talking about wanting to do. Just quickly then, sort of some of the recommendations that we were asking, sort of, you know, in your own words, that we're talking to you, what would you kind of advise other people? And we heard that when they're thinking about how to kind of help other women in sort of maybe just newly coming into caring or newly leaving the labour market, they're very much advised sort of, you know, you speak up, you lean on the network you've already got, and that actually sort of advocating and fighting for yourself and for your loved ones you're caring for to get that support, sort of asking for it, knocking on doors. If networks don't exist, building them. Might not be the ideal enabler, but that's the thing that they've often learned. For employers, they would advise that there's real flexibility, genuine flexibility, not just on paper flexibility. And it's about not making assumptions, having a conversation. You know, if you're recruiting somebody and they've disclosed that they've got caring responsibilities and interested in flexibility, make that a two-way conversation. Might that look like in reality? What would be realistic? What might not work? Other ways to work around it. Carers are reliable, they're skilled. Often it means they need to be kind of available to answer a quick question throughout the day, not that their entire day is gone on the caring. And as one of the women put it, just because I struggle to attend on site, it doesn't mean I can't work at all. And I think that's really, really important to remember. For support services, they would advise signposting early, keeping the support human. Obviously, not everybody can know everything about every condition, every caring circumstance, but if everybody's sort of relating to that person on a human level, hearing not just what they're asking for, but other circumstances that might be around that, and, you know, pointing people to help, even if it's not something that your service can provide, and being able to do that sort of human face of those referrals. And yeah, we did hear a lot of really optimistic things. A lot of them were talking about kind of they're excited or looking forward to, but there's this constant frustration of they're coming up against barriers. They want to get past that and they want to be economically active again. So what does this mean for the Trailblazer? So Trailblazer kind of priorities. Here we've got engaging and supporting people into work. So the key things there are around putting agency, confidence and choice at the centre of that. So whether that's helping improve access to sort of that replacement care, helping people to be able to sort of maybe formalise or explain those caring and life skills that they've got as genuine assets, whether it's around kind of either confidence building or helping to sort of develop some of that soft skills around sort of confidence and explaining why being a carer is a benefit for a workforce. And then obviously priority 2 is working with employers to create good work opportunities. So we know that times are tough for businesses, as Emily mentioned, but there is a real opportunity to access a wider talent pool if you can get the kind of the flexibility, part-time or term time rules right. And for that to be individualized, every single woman we spoke to had a slightly different version of her story. Although there's lots of common themes, one size won't fit all in terms of what supporting someone in work would look like. And I think it needs to be a conversation. And that might also look like sort of help for employers to be able to understand what supporting a employee, you know, this increasing amounts of information and programs to help employers understand how to help an employee with a disability themselves or a long-term condition themselves, but actually what help do employers need to be able to learn what they need to know about supporting a carer. Case studies of real carers talking about how they've made it work, or maybe even things like carers passports, so that there's a sort of documentation a carer can bring along and an employer can really easily understand what their circumstances and needs are. And then, yes, third priority is around joining up systems and services to make it easier for people. So this single front door of where to start is really, really important. And I think this is really important to think about as well. It's not just in terms of where do I go for support with caring, but actually, can you have a single source of information or single point that you go to where you find information about work, you find information about training and skills, you find information about caring. Really recognise that. And for most women, they don't have just one thing that they're interested in. They do have complex lives, and lots of overlap in here. And also, obviously, again, voluntary community sector are really, really important in providing a lot of the services, providing a lot of the advice and support, and providing a lot of the sort of moral and moral support and emotional support. So funding or addressing sort of precarious funding situations in that sector is really important as well. And then just finally, sort of, if we kind of spin that around into terms of what we heard from women and what that might look like in terms of delivery levers, this isn't kind of the start of conversation on this. This isn't the be all and end all single answer. But if we think about sort of actually how it might translate into policy and practice, so flexibility being really important, that might be an employer support program. It might be helping employers to sort of design that flexibility or think how it could work for them. Where support's fragmented, as we mentioned in the previous slide, having a single route so that advice for all different aspects of life is in one place. And there's probably also something there around, you know, the postcode lottery geographic element, and maybe there will be things to fill in, but that having information in one place to start with is a really great place to start. The peer and community support being really, really vital, we heard. So that might look like community grants or the way that BCSE organisations or get the funding. And this big one throughout, childcare, replacement care costs, and that making it tricky to get work to pay. That could be around targeted childcare support. It could be around more flexibility on how to access childcare, you know, on bigger employers having childcare on site, for example. Just sort of making it more options to fill in those gaps there. So that really brings us to the close of the presentation. I want to thank all of you for listening today, but also really, really want to thank those women that we spoke to that shared their stories so openly, and the ones who we had more interest than we had time we could interview them all. So thanks to all of the women who did share their stories or volunteered to, and to the partners and networks who shared our flyers, posted things on social media for us, really made the research possible. It was really important. And I want to leave you just with one sort of takeaway, one-line takeaway, is that these women that we spoke to, they're constrained by their circumstance. There are barriers, but barriers are fixable through structures, through programs, and there's a huge, strong potential talent pool out there, and a lot of motivated people who would love to be working if the circumstances were right. Thank you very much, everyone.